Hartford Healthcare Health Equity Initiative, sponsored by
Good evening and welcome to a very special broadcast from the Bushnell Center for the Performing Arts. In an ordinary year, we would all be gathered here together. It would be filled with people celebrating Hartford Healthcare's largest annual fundraiser, the Black and Red. But this is no ordinary year. There are no galas, no large gatherings. But tonight, we make a promise to you, a promise to our communities as we look back on all that we have learned, as we say thank you and celebrate the commitment of our colleagues in healthcare. Tonight, we make a promise to be better than normal.
Better Than Normal, presented by Hartford Healthcare.
I'm Rebecca Stewart, and with me tonight is Hartford Healthcare President and CEO, Jeffrey Flaks.
Good evening.
Good evening. Thank you so much for being a part of this. You know, when we look back, I really believe that you've created this term better than normal. Take us through what it means to lead through a crisis. You had been the CEO for just months.
We made a decision from the onset of this crisis. That's why we exist. It's why we're here. This is our mission. This is a generational moment in that we would do everything humanly possible within our health system, whatever resources we had, whatever capabilities, to support and serve our community. It's why we exist.
And you've made a promise. You've been very clear. This show is called Better Than Normal. Tell us why.
Look, in so many ways of our life, we want to return to normal. We frequently talk about that. But in healthcare, we're going to be better than normal. There's been so many learnings, so many developments and advances throughout this crisis that when we emerge outside of it, healthcare will be better. We're going to do a better job of using virtual health to reach more people and create more access. We're seeing new infection control procedures in our hospitals beyond anything we've ever done before. And most importantly, and it's really why we're here tonight and why we're focused this evening, it's around health equities and health disparities, which have never been more apparent than they are in this moment, and we are absolutely committed to making a difference.
And we're so grateful for all of you who have taken part, who have really reached in to give to this very, very worthy cause as we talk about health equity, and we have an announcement tonight.
I'm so inspired. Right? We're committing $1 million to our food pharmacy initiative. This is amongst the first in the country, and this is a tremendous opportunity for us to have our physicians, our clinicians, prescribe food specifically to address disparities in healthcare. It's going to make a huge difference within our community.
And food insecurity, especially during COVID, has reached and touched so many people. We know 50 million Americans right now are experiencing some sort of food insecurity, half of them children. This will make a tremendous difference, and we urge you to also make a difference and join this cause. Now, as we talk about Better Than Normal and we talk about how people have stepped up, you have called the people you work with heroes.
They are. It's been incredibly inspiring to see people working on the front line of healthcare. They're heroes.
So, Jeff, let me ask you, when you look around, and here we're in a hall where we typically are, it's filled with people. What is it like to look back and see these empty seats?
I mean, in some ways it's heartbreaking, but in the other way, I know that we're going to be back next year. It's going to be better than ever. And that's what this is really about tonight, recognizing that things are going to return to normal and, in fact, be better than normal.
Better Than Normal. Jeffrey Flaks, President and CEO of Hartford Healthcare. Thank you.
Thank you.
We have so much hope tonight for a better future, and we want you to be a part of Better Than Normal. To do that, head to betterthan.org, and there you can donate, you can make a difference. Now, you can also sign up for a COVID vaccine once it's available to you and you're eligible. You can learn more how we can all make a better tomorrow. This is a time of tremendous gratitude and for the grit that we've seen over these past 11 months, for all of those there on the front lines, and one of them, Keith Grant, our System Director of Infection Prevention.
We are experiencing a pandemic, but there is hope. What I expect to happen after this is that this distance that this virus have created through social distancing is going to bring us significantly closer. I imagine families hugging each other a lot longer. I imagine families now appreciating and probably regretting sometimes they could have spent together. And I think this virus has gotten us to a point mentally that we're going to focus on these things. I am Keith Grant, Hartford Healthcare's Infection Prevention Program. My primary goal is to ensure everyone here is fine. No one gets infected. No one gets sick from the hospital. Everyone's protected by the highest level of PPE based on the risk. When I leave here, I need to know that whatever I said to someone, it's the right thing. There's something that I saw that was really, really good. I remember going in the room. The nurse that was in the room was very concerned for me. So I was ready to leave the room and she stopped me and she said, I'm going to walk you through how to take the PPE off. She has no idea who I am. And I never forget that. And it was just watching a process that you theorize, like you build. But she walked it through and it was excellent and it was perfect. But she was doing it because she was very, very concerned for me. But I was doing it because it was built because I was concerned for her and all our colleagues. There's so many people that will celebrate after this is done. The person who provides the food for the patient, the person who turned the beds over to ensure that we have enough space, the person who admits the patient, like all healthcare providers. That's priceless. That's absolutely priceless.
Such a remarkable colleague. And joining us now, Senior System Director of Infection Prevention, Keith Grant. And Keith, we thank you for all that you have done over this last year.
Absolutely. Thank you for having me.
You've had your second dose of the Pfizer vaccine. What do you want people to know? I mean, you were very adamant that you wanted folks to see you get it and that you believed in the science.
Absolutely. So believing the science is key. If you look at the trials from Pfizer and Moderna, the two primary vaccines we have now, it's safe. It's effective. I've had my second dose, still doing perfectly fine. I could tell you the side effect profiles that were outlined within the trials are still within what we're seeing with everyone that's getting the vaccine right now. The vast majority of people have no symptoms or no side effects, so to speak. So very safe, very effective vaccine.
And when you look at the community and how much people came together, even as we talk throughout this program, we're raising $1 million tonight for health equity. And throughout the last year, we've raised more than $2 million, also with health equity, with mobile testing. What does it mean to you and to your teams to know the community is behind you every step of the way?
Yeah, and this is key because Hartford Healthcare doesn't exist without the community, and that's really key. And what we've done, we've found a way how to even collaborate even closer with the community, work even closer with the community. And you're right, there's a number of issues that we need to work on together to work out. Health equity is a huge part of it. We've seen what that's contributed to, where mortality rates within certain communities, within our broader community. And our pledge is to use these lessons learned, these commitment to ensure that we're impacting this going forward.
Keith Grant, we thank you for all that you are, all that you have been this last year, and all that we know you will be. Thank you. Throughout the pandemic, caring for our community took on new meaning. We saw underserved communities, communities of color, Latinx communities hit harder. So Hartford Healthcare activated to make a difference, and you, our community, responded. You raised $2 million to help bring testing to the underserved, to help create a colleague assistance fund, to help with emotional support throughout all of this. It's all part of our mission, and it requires passion.
My name is Trisha Obas. I'm a COVID testing site lead for Hartford Healthcare. With the second wave going on right now, COVID would spread much faster without me doing what I do every day. I'm stopping the spread.
They're giving us confidence. They're giving us hope You know, I say to Hartford Healthcare, certainly it's about the health and safety, but it allowed us to continue to do our work, to serve the population that we serve.
I'm proud of what we're doing, and I'm proud that there are people like my colleagues who are doing what's good for the community.
Hartford helped make my household better because my mother know I'm getting tested on a regular. That's the beauty of the place, you understand what I'm saying?
COVID would spread much faster without me doing what I do every day.
So many people came together to make a difference. So why were our communities of color hit harder? Joining us now is Sarah Lewis, Hartford Healthcare's Vice President of Health Equity. Thanks so much for joining us. So COVID put such a spotlight on this, and tell us why the disparity?
Great question, Rebecca. And I think what you're referring to are what we call the social and structural determinants of health. So whether a person or their family has access to fresh fruits or vegetables, access to transportation, clean water and clean air, a good stable job and stable clean housing, all of these things can lead to someone having, if they don't have all of those things in place, chronic conditions and health status that can make them more vulnerable for the pandemic that we're currently living through. And unfortunately, that's what we saw, is what made this crisis for the globe something of a catastrophe for many in our Black and Hispanic communities.
Tonight, we're raising money to make a difference. You touched on this, but tell us why food insecurity directly relates to health.
Rebecca, sometimes we have patients telling us that they have to decide whether to fill a prescription or buy food for their families. That sort of insecurity, that's the marriage of food and economic insecurity, means that they're not going to be able to get well. They're not going to be able to take care of themselves and by extension take care of the people that they care for without the food that they need to put in their refrigerators and put in their pantries. We want them to be able to follow their healthcare regimens, and having that staple diet is such an important part of that process.
In this program, we're talking about being better than before, making sure that doesn't happen again. So from your lens, what does better than normal look like?
Better than normal for me looks like health equity in real life. So that means that everyone, regardless of their background or any other identifier, has the opportunity to have a full and healthy life.
Sarah Lewis, we thank you. So how can you help us be better than normal? You can head to betterthan.org to make a donation to communities who right now need your help. Most folks will say that working in healthcare is more than a job. They'll tell you it's a calling. At St. Vincent's Medical Center, the mission and the miracles continued all throughout COVID. Babies were still born across the state, traumas treated. Jocelyn Mementa joins us now from St. Vincent Medical Center with a look at how caring never stops, not even during a pandemic.
As a former news anchor and medical reporter, I had a front seat to the outbreak of the pandemic. Fairfield County was the hotspot of COVID-19 in our state. Through it all, St. Vincent's Medical Center was steadfast.
Okay.
Coping with spinal cord compression, Rich Conine required neck surgery amid the pandemic.
Watch this spinal cord here. What happens to it? It really gets squeezed and pinched.
Rich was treated at St. Vincent's Medical Center.
COVID patients are in a completely different part. He says, you're going to be so sterile. I'm feeling good.
Diagnosed with stage 2 pancreatic cancer. Timely treatment was essential for David Sansone at the height of the outbreak.
He's cancer-free. He's completely, essentially cured from cancer because he removed his cancer completely.
They stress team here. I used to coach basketball, and I know the importance of team play.
Nicole Nesmith found herself fighting breast cancer again in the middle of COVID.
The one thing I don't want to do is lose my hair again.
You're being told that we're going to address your mortality as well as your self-perception. Who wouldn't want to lose their hair?
The last time I didn't have no eyebrows, no eyelashes, no nothing. I still got my eyelashes and my eyebrows, so I'm thankful and I'm grateful.
Trumbull EMS transported Brian Griffin to St. Vincent's Emergency Department during the second surge.
I said I was having a stroke.
Minutes are critical for stroke patients.
They get
quickly screened at the door, go straight to CAT scan, because what we're trying to do is shorten the time between their arrival here and the treatment that they need.
Fear of exposure to COVID patients
They're in a different part of the hospital.
quickly diminished.
Oh, that was very comforting. That's why I didn't bother any further, because I felt myself go whoosh.
Compassionate care, the heart of St. Vincent's Medical Center, never faltered in these uncertain times. A $50,000 donation to area shelters and monthly food distribution reinforce St. Vincent's commitment to those most in need in the community. St. Vincent's continues its fight with enhanced COVID testing, vaccine clinics, and patient-centered care in the Fairfield region. I'm Jocelyn Mamenta with Hartford Healthcare St. Vincent's Medical Center.
As we give thanks to our remarkable colleagues all across the system, we also think of all of our patients. In Connecticut, more than 221,000 people have been diagnosed with COVID-19. And of course, we have taken care of many of them. Of course, some of them the most critically ill. We tonight remember those we lost, and we celebrate those whose lives we saved. Tina Verona had the chance to catch up with one remarkable survivor, Jay Bielkowski.
Whatever the story is, there's always a purpose.
So we're going to share a story about a person, and this person is a colleague of ours. He's a public safety officer, Jay Bielkowski.
One morning he wakes up and his life is forever changed. The next thing you know, he's here at Hartford Hospital in the emergency department. He goes up to the ICU. He's there for a month. His major organs are failing. He's paralyzed. And then something happens and he comes back. He's a walking miracle. It's really great to see you.
It's nice to be able to be here.
Tell me about that. What does that mean when you say it's nice to be here?
You know, I mean, I think we all take it for granted. Not anymore. I think it takes an event like this to really bring you back to reality and what's important.
You know, you mentioned that there were times where you wanted to give up. How did you sort of quell that inner part of you saying, I want to give up? How did you get past that?
I thought of two people, my wife and my daughter. I said, I can't do that to them. You know, they've been through enough. I want to get home.
How does that look to you?
It's great.
This is the last piece.
It is.
This is what's going to make you whole again.
My next big hurdle for me is going into Red 6.
Going back to the place you were. I mean, to say, Jay, that you're a fighter almost seems like an understatement. I mean, you're a warrior.
I appreciate that, but I got to go back into Red 6 and, you know, face the demon.
Yeah.
You have to.
Are you ready to do this?
We're going to find out.
The door waits.
I was just one of the lucky ones.
We're so happy you're okay.
So grateful to all the providers, everybody at Hartford Hospital, that they never gave up.
This is what's going to make you whole again.
That's the final piece of the puzzle to getting my life back.
Working through COVID, through all of these unknowns, it wasn't easy, but not once did our colleagues waver. They are called to this work, and they stepped up when everyone else was told to step away.
Good morning. Good morning. How are you? Good. How are you doing? Good. We get screened every morning to make sure that as we come into the hospital, we're not bringing, any potential issues with us. I'm going to kind of set my mind for the morning. I can't be sad or tired. I'm not going to think about family and friends. We're going to just leave that behind for now. So it's an honor to care for all of the people that are struggling through this pandemic and to have such incredible coworkers, doctors, PAs, NPs, CRNAs, nurses. I work with an amazing group of superhuman people, and we are a family here. For us here now, the impact of COVID, it's very difficult. I had a patient who we took his breathing tube out, and he woke up and the first thing he said was, "I miss my wife so much." And we called her and she was so excited to talk to him. So to be able to be there in those times, just know that we're here. Since we're getting closer, I want to just take a minute in silence to honor all the people that are struggling through this, those that have lost their lives and those that are fighting for their lives. All right, here we go into the unit.
We all remember that rainy day in December when those vaccines first arrived. Nothing could dampen our spirits. Finally, there was such hope.
This is a moment for incredible hope. This is the dawn of a new day. Frontline healthcare workers, these are people who protect us. And in this moment, again, our frontline healthcare workers are going to step up. They will be the very first people in our state, amongst the very first people in our country, to get this vaccine. I have respect beyond that I can put in words for what I see from our team every day.
They are pioneers, part of history, really choosing to take the vaccine to help all of us turn the tide. And one of the first in line in the entire country is Melissa Cumberland, a physician at Windham Hospital. Now, Dr. Cumberland, it was very important to you that you were visible throughout this, and you've actually said people need to see people who look like me. Tell us why that was so important to you.
People need to see a person that looks like them. Minorities need to see a person that looks like them. We as minorities have the highest comorbidities of high blood pressure, diabetes, and obesity. And all of those disorders have been really linked to greater instances of increased severity from the disease, worsened disease when you're infected with COVID-19. And we need to hear that. We almost need that little bit of fear to hear that and to say, wow, I really am at a higher risk. They need that reality. But I have to be able to say it to someone who looks like me because that's who we trust.
I know you are a mother of 5, and you said that very much you're eager to be able to walk through that door just like old times and have your kids come give you big kisses and a great big hug. So we wish that for you. Dr. Melissa Cumberland, thank you so much. We have to say the community has been amazing throughout the pandemic. You've paid attention, you've worn masks, you've listened, you've stayed home, you've stayed distant, and it hasn't been easy. But you also jumped at the opportunity to help. Remember making masks, donating all of those meals? Tina Verona joins us now with more.
Last year, the Hartford Hospital Auxiliary took giving back to new heights. Not only did they help purchase much-needed supplies for hospital frontline staff and provide meals, but they worked countless hours to help the community. Joining us is Shelley Dodd, board member of the Hartford Hospital Auxiliary. Shelley, it is always a pleasure to see you.
Hi, Tina. On behalf of the entire board,
Thank you for having me.
You bet, my pleasure. Well, the auxiliary donated an impressive $250,000 for the COVID-19 pandemic fund. Tell us how the money was used.
Well, $100,000 went directly to housing to frontline employees who needed housing outside of their homes, so as a safety measure to not infect their loved ones. We also donated $100,000 to the Nurses Uniform Initiative, which allowed the hospital to purchase an extra pair of scrubs for all nurses and PAs. And we also donated $50,000 in meals, which was almost 6,300 meals to several areas of the hospital over several months.
You know, the Hartford Hospital Auxiliary is a small but mighty group, and I am so always awe-inspired by the tremendous work that you do each and every year. So we thank you. We're so grateful.
Thank you so very much.
When it is your turn, we hope that you will proudly roll up your sleeves. You can head to betterthan.org to learn more about the vaccine and even to sign up so that when it's your turn, you will be ready. On that site, you can also take the time to create a better than normal future. You can donate. We want your help as we all work together to address food insecurity and so much more. And we hope you'll join us.
I don't think you should be afraid because it's going to be helpful and it's going to bring us back into the kind of normalcy that we need in our communities.
I felt more than ever humbled to know that we, mankind, in particular the healthcare workers and providers, and we can go through this pandemic together, shoulder to shoulder.
Well, this is Jim Calhoun, and I think I tried to make a lot of short shots when we were a basketball team at UConn, now St. Joe's. Well, I took one today. I got a short shot. What I got a shot in my arm, which I think is great for me, my family. You know what? And for everybody else in America, the incredible job they're doing here today at the Convention Center is wonderful. And I think all of you, I beg and plead of you, help yourself, help your family, and help all of us to eradicate this terrible, terrible pandemic.
You guys were absolutely invaluable on the front lines every day, doing everything we needed to keep people safe. We had to think along the way, didn't we, Jeff? When it came to, certainly when it came to the testing, now with the vaccines. I was there when we were first in the state, first in the country perhaps, to get somebody vaccinated. Anyway, and to all the nurses and docs in particular, I know the incredible stress you're going through every day. We appreciate it. On behalf of the people of Connecticut, we appreciate it.
It has been such an honor to be with you tonight, to recognize all of the amazing people who have worked so hard. We thank you wherever you are on the front lines. And our patients, we are thinking of you tonight. Together, we make sure that we will keep this promise, a promise to use this year to let it teach us how we will not go back. We will be better than normal. I'm Rebecca Stewart. Good night.